This is Main Street, not the entrance to a major city shopping mall, but the gateway to the Royal Children's Hospital, opened by Her Majesty the Queen in 2011. And the thing that strikes you the minute you walk through the doors is that it doesn't feel like a hospital.
One of the big intentions of the architects and all of the medical professionals that actually helped design the hospital, because it was very much about the fact that lightness and brightness and airiness and art all around children can really help them heal faster. And so that's been the big difference and the big shift in healthcare between the 50 years of the old hospital and this new hospital. The RCH here in Melbourne is incredibly connected to all of its people right throughout the state. So we're the only specialist paediatric hospital here in the state right now. It's been going since 1870, so 142 years of being the centre of people's lives and how their children are cared for. The history of giving goes back to 1870, goes back that long. The auxiliaries have been going 90 years, Good Friday over 80. So people actually have been giving to the hospital for that length of time. And you can see how children's health has changed in 140 years. When this hospital was established, it was really about indigent children. It was really about children who were there to die, and that's the truth of the matter. Now, we don't have that situation anymore. I think, it's true to say that if you're touched with illness, with your child being touched with illness, that stays with you forever. You're at your most vulnerable because your child's at your most vulnerable. So I think people have remained, concerned and interested and supportive of the children's all the way through that. Where there's family, to make those connections and to build that sort of intergenerational generosity, which is an enormous part of what we're doing. It's growing all the time. Many times we don't know that these gifts are coming, which is an amazing surprise and a great feeling of generosity for us. But where possible, we'd love to know that they're coming so that we can actually say to the family, with this money that auntie or uncle or mum or dad has left, we've been able to do this. Generosity that people imbue with a gift in a will, with a bequest, is unmatched, I think. It's what they've decided to do there is they will have given during their lifetime, more than likely, but they make a decision to actually give so that their life and their legacy is thought of beyond their life. And just behind us, I think they're setting up for an event which is with our Education Institute. So we've got a group of teachers here who are working with the children at the bedside to keep learning going. The Meerkats, the aquarium, that's all about distraction. A lot of funding that people donate to goes into educational play therapy, goes into music therapy, goes into things that will distract, will educate and will entertain, because absolutely that's incredibly important. Now, that doesn't replace treatment, it doesn't replace any of that care, but it is something that evidence shows us all around the world, that arts programs, that education programs, that distraction actually helps in the healing process. The other part of the important role that we do is to ensure that donors' funds are really well utilised, that they do what the donor wanted them to do, they make the greatest impact, and they make the biggest difference for the children and for their patients. So the sort of changes that we're making when research is translated into clinical practice, the sort of change that we're making by focusing on the patient and on their family, those sort of changes are really possible because of the generosity of people.